In this session, we will try to discuss about hip bone. See, this is hip bone. It is constricted in the central part. See, here it is constricted in the central part. In the upper part and in the lower part, it is expanded. Right? In the constricted part, you can see acetabulum. It gives articulation to the head of the femur. Then, in the lower part, you can see one foramen. This foramen, what we are calling obturator foramen. Before going to study about any bone, we should keep it in anatomical position. Right? So, how will you keep it in anatomical position? See, this is posterior border of hip bone. In the posterior border, you can see one notch here. Is it? This notch, what we are calling greater sciatic notch. Right? So, keep your thumb in the greater sciatic notch and hold it like gun. Right? Now you have hold it like gun. Then keep it in vertical position in a such a way that this is iliac crest. Right? Iliac crest should be directed upwards. Then here this is ischium. Ischium should be directed downwards. And this is pubis. Is it? This pubis should be directed downwards, forwards and medially. Right? And when you hold it like gun, your palm should be facing towards the acetabulum like this. Then the direction of acetabulum in anatomical position is directed downwards, forwards and laterally. Right? So, along with that, one more consideration is there, that is, see here, this is anterior superior iliac spine and this is pubic tubercle. Right? These two should be in the same coronal plane. Right? You should not keep like this, because these two structures should be in the same coronal plane. So, you have to keep it like this. Right? So, this is anatomical position. Anterior superior iliac spine and pubic tubercle should be in the same coronal plane. Iliac crest should be directed upwards. Ischium should be directed downwards. Pubis should be directed downwards, forwards and medially. Acetabulum should be directed downwards, forwards and towards lateral side. Right? So, if we keep this bone in this position, this is anatomical position. Then we will see what are the presenting parts and what are the different features of it. Hip bone formed by three bones. This is ilium, this is ischium and this is pubis. These three bones are separated before puberty by one triradiate cartilage. Like this, there will be one triradiate cartilage will be there. This triradiate cartilage is Y-shaped, so that it is having stem and it is having limbs. Is it? So, these two are limbs and this is stem. Stem is projecting backwards, limbs are projecting front, that means projecting anteriorly. So that acetabulum divided into three parts. This is upper part, this is infero posterior part, this is infero anterior part. If you wanted to say specifically, this is superior 2/5 and this is infero posterior 2/5 and this is antero inferior 1/5. If we divide the acetabulum into 5 parts, 2 parts by ilium, 2 parts by ischium, 1 part by pubis. Before puberty, there will be one Y-shaped cartilage. That Y-shaped cartilage, what we are calling triradiate cartilage. That triradiate cartilage will be ossified after puberty, so that these three bones will be united and form single hip bone. Now we have divided into upper part ilium, anterior inferior part pubis, posterior inferior part ischium. Right? Now we will discuss about ilium first. Ilium having the lower end and upper end. See, this is upper end, this is lower end. Lower end is fused with the pubis and ischium in the floor of the acetabulum. Right? So, that's it about the lower end, not much. Then, what is this? This is superior end or upper end. This upper end is like bony crest or it is like a bordered. That's what this upper end of the ilium, what we are calling iliac crest. See, this is iliac crest. Iliac crest is sinuously curved. Sinuously curved means, see, it is S-shaped curve. So that we are dividing the iliac crest into ventral part and dorsal part. Ventral part is convex outwards. Dorsal part is concave outwards. Now we are dividing the iliac crest into anterior part and posterior part, otherwise ventral segment and dorsal segment. Actually, iliac crest extending from anterior superior iliac spine to the posterior superior iliac spine. See here, one bony projection is there in the anterior most part of the iliac crest. This bony projection what we are calling anterior superior iliac spine. In the posterior part also, so you will see one bony projection. This bony projection what we are calling posterior superior iliac spine. See, this is iliac crest. It is extending from the anterior superior iliac spine to the posterior superior iliac spine. It is divided into ventral segment and dorsal segment that we have already discussed. Now we will discuss about ventral segment first. This is ventral segment from here to here. In the ventral segment, you can see the summit of the iliac crest. Summit of the iliac crest means highest point of the iliac crest. See, this is highest point of iliac crest, what we are calling summit. This summit will be present just behind the midline of the iliac crest. If you take right hip bone, this is summit of the right hip bone. And if you take left hip bone, same structure will be there in the left hip bone also. So, if you make the line from the highest point of one hip bone to the same point of another hip bone, that line what we are calling supracrestal line, right? Why we are discussing about this? This supracrestal line passing along the lower border of L4. It is very important for the anesthetist. In between the L3 and L4 only we will do lumbar puncture for either inducing the anesthetic substance or removal of CSF. So that's what this point is very important. Now we will see what are the different features in the ventral segment and what are the different features in the dorsal segment. If you take the ventral segment having the outer lip, this is outer lip and inner lip. If it is having outer lip and inner lip, there will be intermediate area, is it or not? So outer lip, inner lip, intermediate area. Outer lip having one tuberosity 5 centimeters behind the anterior superior iliac spine. See, this is tuberosity. This tuberosity what we are calling tubercle of iliac crest. From the anterior superior iliac spine to the tubercle of iliac crest, we can find one muscle. It is taking origin from the outer lip up to the where? Up to tubercle of iliac crest. So this muscle what we are calling tensor fascia lata. So here tensor fascia lata. Clear? Then outer lip will give insertion to one muscle. It is one of the abdominal muscle, external oblique abdominis muscle. What is it? External oblique abdominis, right? This external oblique abdominis inserted up to anterior 2/3 of ventral segment. The posterior 1/3 of ventral segment gives origin to the latissimus dorsi. In between these two muscle attachments, this part will give space or gap for the lumbar triangle in between the external oblique abdominis and latissimus dorsi, right? This area. Clear? So these are the attachments to the outer lip. Then intermediate area. See, this is totally intermediate area. This intermediate area gives attachment to internal oblique abdominis. Totally internal oblique abdominis. Total intermediate area of ventral segment gives origin to the internal oblique abdominis muscle, right? Then what is this? This is inner lip. Inner lip will give origin to the transverse abdominis and also quadratus lumborum. See, anterior 2/3 transverse abdominis, posterior 1/3 quadratus lumborum. So these are the attachments to the ventral segment. Very simple. Recollect once again. Outer lip from anterior superior iliac spine to the iliac tubercle. What is this? Tensor fascia lata, right? Then outer lip only. This is insertion of external oblique abdominis, right? Then posterior 1/3 of outer lip of iliac crest gives origin to the latissimus dorsi, right? Then intermediate area, internal oblique abdominis. Then inner lip, ventral part transverse abdominis and posterior 1/3 of ventral segment of inner lip of iliac crest, giving origin to the quadratus lumborum. These are the muscles which are attaching to the ventral segment. Then dorsal segment. If you coming to the dorsal segment, this is dorsal segment from here to here. Dorsal segment is opposite to the ventral segment. Ventral segment having outer lip, inner lip, intermediate area. But here intermediate crest, outer sloping surface, inner sloping surface. Here intermediate crest, outer sloping surface and inner sloping surface. See, this is intermediate crest and outer sloping surface and inner sloping surface, right? Outer sloping surface gives origin to one muscle. What is that muscle? Gluteus maximus. Here gluteus maximus. Then inner sloping surface, erector spinae, and intermediate crest, this crest will give attachment to the posterior layer of thoracolumbar fascia. Posterior layer of thoracolumbar fascia, right? So this is about iliac crest. But we should see what is the anterior end and what is posterior end. See, this is anterior end of iliac crest. In the anterior end of iliac crest, you can find one bony projection that we have seen. What is that? Anterior superior iliac spine. What is it? Anterior superior iliac spine, right? This anterior superior iliac spine gives attachment to one ligament and one muscle. What is that ligament and what is that muscle? This is ligament. What is this ligament? Inguinal ligament attachment. And what is this? This is muscle. Which muscle? Sartorius muscle, right? So anterior superior iliac spine gives attachment to the inguinal ligament and sartorius muscle. That's it. Then posterior superior iliac spine. Here posterior superior iliac spine. This posterior superior iliac spine gives attachment to the sacrotuberous ligament. That's it. Then we will see borders. Ilium having anterior border, posterior border and intermediate border or medial border, right? So this is anterior border, this is posterior border and this is medial border, right? Now we will see one by one. Anterior border starts below the anterior superior iliac spine. So in the upper part it is like notched. Then in the lower part it forms one projection, or the lower part of the anterior border shows one bony projection. This bony projection what we are calling anterior inferior iliac spine. This is anterior superior iliac spine and this is what? Anterior inferior iliac spine. This anterior inferior iliac spine gives attachment to one muscle and one ligament here also. So what is that muscle? Straight head of rectus femoris. Straight head of rectus femoris. And the ligament is iliofemoral ligament. What is that ligament? Ligament is iliofemoral ligament. Muscle is straight head of rectus femoris, right? Then below that anterior inferior iliac spine, anterior border ends at the upper border of acetabular margin. See, this is acetabular margin, right? At the upper border of acetabular margin, anterior border is ending, right? So that is about anterior border. Then see, this is posterior border. This is posterior border. See, I am showing like this. See, this is posterior border. Posterior border extends from the posterior superior iliac spine. It is extending from the posterior superior iliac spine. Then in the posterior border you can see one more bony projection. This bony projection what we are calling posterior inferior iliac spine. Then the posterior border continues down and forms the upper part of the greater sciatic notch and the anterior part of greater sciatic notch. That means this part and this part, right? So up to here it is posterior border. Then from here posterior border continues down as posterior border of ischium. Is it? So posterior border of ilium continues as posterior border of ischium, right? So after forming the superior border and anterior border, or superior boundary and anterior boundary of greater sciatic notch, it continues as posterior border of ischium, right? So this is about posterior border. Clear? Then this is medial border. This is medial border. This medial border extends from the iliac crest. It is extending from the iliac crest. Then it ends at the Ischiopubic eminence here. It is ending at the Ischiopubic eminence. If you observe carefully, this is upper part. This upper part is rough, middle part is projected and the lower part is rounded. This upper part is rough because it gives attachment to the iliolumbar ligament, right? Then the middle part is sharp because it is forming the anterior margin of auricular surface of ilium. Lower part is rounded. This lower part is forming the one of the boundary of pelvic brim. So what is this part? Arcuate line. So this is arcuate line. This arcuate line ends at the iliopubic eminence. See, here one eminence is there. This eminence is formed by fusion of ilium and pubis. So this eminence what we are calling iliopubic eminence. So very simple, medial border extending from the iliac crest to the iliopubic eminence. Upper part is rough because it is giving attachment to the iliolumbar ligament. Middle part is more prominent or projected because it is forming the anterior margin of auricular surface of ilium. Then the lower part is rounded. This part is arcuate line. So now we have seen three borders. Now what are the surfaces? See, in between the anterior border and the medial border, here one surface is there. This surface what we are calling iliac fossa because it is like a depression. That's what this fossa what we are calling iliac fossa. Okay, actually it is a surface, but it is like a some fossa or some depression. That's what this surface what we are calling iliac fossa. This iliac fossa will be giving the origin to the iliacus muscle. So it is giving origin to the iliacus muscle. That is only about iliac fossa. Then behind the medial border or in front of posterior border, this area is sacropelvic surface because this part articulates with the sacrum. So it is sacro, and this part will form the lateral boundary of pelvis. So sacropelvic surface, right? This sacropelvic surface having the sacral part and pelvic part. First, if you discuss about the sacral part, this is sacral part, right? This sacral part having the auricular surface. See, here it is ear like auricular surface is there. This is ear like auricular surface, right? So this ear like auricular surface articulates with the, see, what is this bone? Sacrum. It is articulates with the ear like auricular surface. So it is articulating like this and it forms the sacroiliac joint. Here also ear like articular surface is there. Here also ear like articular surface is there. Both will be articulated with one another and forms sacroiliac joint. See, this is sacroiliac joint. Clear? So this is auricular surface, right? Behind the auricular surface we can see the rough part, this rough irregular part. This rough irregular part what we are calling tubercle or tuberosity of ilium. So what is it? Tubercle of ilium. Posterior to the auricular surface it is very rough, right? So this rough part gives attachment to some ligaments from posterior to anterior side. Here iliolumbar ligament. What is this ligament? Iliolumbar ligament. Then here one more ligament. What is that ligament? Dorsal sacroiliac ligament. Dorsal sacroiliac ligament. Then here one more ligament is attaching, that is interosseous sacroiliac ligament. Interosseous sacroiliac ligament, right? Then anterior to the auricular surface, here one ligament will be present. This ligament is ventral sacroiliac ligament, right? Totally dorsal sacroiliac, interosseous sacroiliac and ventral sacroiliac, right? Three sacroiliac ligaments are there. Those are dorsal, ventral and interosseous. Interosseous means what? In between the bones, right? So these are the ligaments, and this is about sacral part of sacropelvic surface of ilium. Then anterior to the auricular surface you can see one depression here, one sulcus. This part, this sulcus what we are calling preauricular sulcus. What is it? Preauricular sulcus, right? So this preauricular sulcus is more conspicuous or more visible or more prominent in case of females, but it is inconspicuous or it is not prominent in case of males. Why? I already told you, anterior to the auricular surface there is attachment of ventral sacroiliac ligament. Ventral sacroiliac ligament, right? That ventral sacroiliac ligament attaches to the preauricular sulcus and it will be stretched during pregnancy. It will be stretched like this, so that this groove or this sulcus will become more prominent in case of females, especially in case of paraswomens. Paraswomens means what? Mother who given birth to the baby. That is about sacral part. Then pelvic part. See, the upper part of the pelvic part are along the upper margin of greater sciatic notch. Actually, this is greater sciatic notch, right? Upper part of greater sciatic notch, it gives origin to one muscle or some fibers of one muscle, because that muscle not only taking origin from this part, it takes origin from some other part also. That's what few fibers taking origin from here, right? What is this muscle? Piriformis muscle. So here origin of piriformis, right? Then remaining total part is smooth and it is giving origin to obturator internus. So it is totally giving origin to the obturator internus. Clear? So this is sacropelvic surface. Then this surface is present in between the anterior border and posterior border. So what is this surface? This surface what we are calling gluteal surface. See, this is gluteal surface extending in between the anterior border and posterior border. So this is gluteal surface. It is having different gluteal lines, right? Those gluteal lines are posterior gluteal line, anterior gluteal line, inferior gluteal line. These lines are extending from or radiating from the upper margin of greater sciatic notch. Upper margin of greater sciatic notch, right? So how they are present? See, from here one line is extending and uniting with dorsal segment of iliac crest, or it meets the dorsal segment of iliac crest. So this is one line. What is this line? It is present posterior most part, posterior gluteal line. And here one more line we can see in the bone. See, it's very clearly visible. This line from the upper margin of greater sciatic notch, it is meeting the iliac crest at the tubercle of iliac crest. See, this is anterior gluteal line. Then another line which is extending from the greater sciatic notch to the upper part of anterior inferior iliac spine. See, this line is inferior gluteal line, right? So this is inferior gluteal line. Because of these three lines, gluteal surface divided into four parts. See, the area present behind the posterior gluteal line and the area which is present in between the anterior gluteal line and posterior gluteal line, and the area in between the inferior gluteal line and anterior gluteal line, and the area which is present below the inferior gluteal line, right? So these are the different areas. Now what are the muscles taking origin from these areas? See, posterior to the posterior gluteal line, this is the area. This area giving origin to the gluteus maximus. See here, outer sloping surface of iliac crest giving origin to the gluteus maximus. That same continuation will be coming here. That means this part also giving origin to the gluteus maximus. Then in between the anterior gluteal line and posterior gluteal line, this part is giving origin to one more gluteal muscle, that is gluteus medius. Gluteus medius, right? Then here there will be area in between the anterior gluteal line and inferior gluteal line. This area giving origin to gluteus minimus. Gluteus minimus. This is gluteus medius. This is gluteus minimus. Right? So totally gluteus maximus, medius and minimus. Right? Then what is the area remaining below the inferior gluteal line? Here there is origin of one muscle. What is that muscle? One of the muscle of quadriceps. That is reflected head of rectus femoris. See here, straight head arising from the anterior inferior iliac spine and the reflected head arising from the area present in between the acetabular margin and inferior gluteal line. So this is the origin of reflected head of rectus femoris. So this is about gluteal surface of ilium. This gluteal surface of ilium, in the lower part, it continues as dorsal surface of ischium. See, it is continuing as dorsal surface of ischium. So that is about ilium. Right? So ilium will be like this. This is about ilium. Any difficulty up to here? If no, we will go for ischium. Now we will see ischium. See, from here to here, this is ischium, and in the upper part it is separated by triradiate cartilage before puberty. Here we have drawn imaginary line of fusion of triradiate cartilage. Right? So this part is ischium. Right? Ischium having body and ramus. This is body and this is ramus. Body having upper end, lower end. Right? Lower end represents the lower part of ischial tuberosity, and the upper end fuses with ilium and pubis at the floor of acetabulum. Now we will discuss one by one. Upper end of the ischium fused with pubis and ilium at the floor of the acetabulum. This is lower end. Then what are the different borders and what are the different surfaces that we have to see now? See, this is anterior border. Anterior border forming the posterior boundary of obturator foramen. Then lateral border. This is lateral border from here to here. This lateral border, in the upper part it is notched. See, upper part of lateral border is notched because through this there will be one tendon is passing. What is the tendon? Obturator externus tendon. Then this part will give attachment to one ligament also. That ligament is nothing but ischiofemoral ligament. Then in the lower part it forms the boundary of ischial tuberosity. That's it about lateral border. Then posterior border. This is posterior border. Posterior border forms the boundary of greater sciatic notch, and below the greater sciatic notch you can see one bony projection. This bony projection what we are calling ischial spine. So this is ischial spine. Below the ischial spine we can find one more notch here. See, this notch what we are calling lesser sciatic notch. That means above the ischial spine greater sciatic notch, below the ischial spine lesser sciatic notch. These notches becomes foramen by attachment of sacrotuberous ligament and sacrospinous ligament. Sacrospinous ligament and sacrotuberous ligament. Right? So if the ligaments are attached here, these notches become foramens. See, here foramens are formed. Right? In the upper part greater sciatic foramen, in the lower part lesser sciatic foramen. So this is the posterior border. Now we have to discuss something about ischial spine. This is ischial spine. It is bony projection in the posterior border of ischium. It gives attachment to the sacrospinous ligament. In the pelvic surface, it gives attachment to two muscles, levator-ani and coccygeus muscle. Levator-ani and coccygeus muscle. At the lower part, it gives attachment to the superior gemellus. What is this? Superior gemellus muscle will be attached here. Otherwise, simply see, this is lesser sciatic notch. Upper part of the lesser sciatic notch gives attachment to the superior gemellus. Lower part of the lesser sciatic notch gives attachment to the inferior gemellus. In the dorsal surface of ischium. These things we will study in the gluteal region. Don't worry. At this session, just you remember the names. So that is about ischial spine. So we have completed anterior border, lateral border and posterior border. Now we will see what are the different surfaces of body. So this is body and here one surface is there, is it or not? It is present in between anterior border and lateral border. So what is this surface? This surface what we are calling femoral surface, right? Because it is in relation with the femur. So this is femoral surface. This femoral surface gives attachment to mainly two muscles. What are those? Along the margins of obturator foramen there will be attachment of obturator externus, that we know. So this is obturator externus. In between the obturator externus origin and the ischial tuberosity, here there is one muscle is taking origin. This muscle what we are calling quadratus femoris. Here quadratus femoris. So what you have to remember in the femoral surface? Two muscles only, obturator externus. Anyway you will remember that because along the margins of the obturator foramen there will be attachment of obturator externus. So that is easy. Then lateral to that, what is that muscle? Here this muscle is quadratus femoris. So that is about femoral surface. Then dorsal surface. Dorsal surface is present in between the lateral border and posterior border, right? So this surface is dorsal surface, right? This dorsal surface divided into upper part and lower part, right? So in the upper part we can see one groove. See, this is groove. This groove accommodated by two tendons. Medially one tendon, laterally one tendon. Here obturator internus tendon, here obturator externus tendon, right? So that is upper part. Actually this upper part is overlapped by one muscle. What is that muscle called? See, it is taking origin from here. One muscle will be coming like this through the greater sciatic foramen. What is that muscle? Piriformis muscle. So piriformis muscle is overlapping the upper part of the dorsal surface of ischium. Then in the lower part you can see tuberosity. See, this is tuberosity. This tuberosity what we are calling ischial tuberosity. So this is ischial tuberosity. This is ischial tuberosity. This ischial tuberosity divided into upper part and lower part by one transverse ridge. This is transverse ridge. Actually here some ridges are broken, but it's okay, I am drawing here. So this is one transverse ridge. This transverse ridge separating this tuberosity into upper part and lower part, is it? So this upper part further divided into superior lateral part and inferior medial part by one oblique ridge. This oblique ridge is visible. See, this is oblique ridge. This is oblique ridge. This oblique ridge dividing the upper part into superior lateral part and inferior medial part, right? Then here this is lower part, no? This is totally, this is lower part. This lower part also divided into lateral part and medial part by one vertical ridge. See, here vertical ridge is there. This is vertical ridge. So that it is dividing into lateral part and medial part. Clear? Now these different areas 1, 2, 3, 4, right? They are having different importance and different attachments, right? So recollect once again, don't confuse here. This is comma shaped tuberosity. See, it is like comma, right? So comma shaped tuberosity. This comma shaped tuberosity divided into upper part and lower part. See, here it is division. This is upper part and this is lower part, right? So upper part further divided into superior lateral part, inferior medial part by oblique ridge, right? So this superior lateral part gives origin to the semimembranosus. See here, muscle attachment is semimembranosus, right? Which part? Superior lateral part. Then inferior medial part. This is inferior medial part. This inferior medial part gives origin to the semitendinosus and long head of biceps femoris. Semitendinosus and long head of biceps femoris, right? Then coming to the lower part. this lower part divided into lateral part and medial part by one vertical ridge, is it? So this lateral part, this part gives attachment to origin of hamstring part of adductor magnus, gives origin to the hamstring part of adductor magnus, right? But this medial part will not give attachment to any muscle. It is covered by fibrofatty tissue. It is covered by fibrofatty tissue. When you are sitting on this bone only. That means on this part only, right? So that is about ischial tuberosity. Then what is remaining? Pelvic surface. See, this is pelvic surface, right? This pelvic surface is forming the true pelvis. That means it forms the wall of the true pelvis, right? So it forms a lateral wall of the pelvis. So this is pelvic surface. This pelvic surface is smooth and it is giving attachment to the, what is this muscle here? Along the margins of obturator foramen and the obturator membrane, gives attachment to one muscle. What is that muscle? This origin of the muscle is like pancreas, the shape of the pancreas, right? What is this muscle? This muscle is obturator internus. Fascia covering the obturator internus at the lower part of the ischium forms one canal here. Here one canal will be there. This canal, what we are calling pudendal canal. What is the importance of this pudendal canal? Through this pudendal nerve and internal pudendal vessels are passing to enter into perineum. Actually, from the greater sciatic notch, three structures from inside to outside, that means from medial to lateral side, three structures will be passing. Actually, these three structures are winding around the ischial spine like this. This is nerve to obturator internus, and here internal pudendal vessels, and here pudendal nerve. This nerve to obturator internus, it will ends after supplying the obturator internus. This internal pudendal artery and pudendal nerve pass through this canal. What is this canal? Pudendal canal, and reaches to the perineum to supply there. Very simple. Pelvic surface giving attachment to the obturator internus muscle, and it forms the lateral wall of the pelvis. Here we can find one canal. That canal what we are calling pudendal canal. Through that canal, pudendal nerve and internal pudendal vessels are passing. Actually, these three structures from medial to lateral side, PIN, P-I-N, pudendal nerve, internal pudendal vessels, and nerve to obturator internus. These three structures are coming out from the pelvic cavity. After winding around the ischial spine, again they enters into pelvic cavity only. So they appears in the gluteal region for disappearance. So they coming out from the pelvic cavity and they enters into the pelvic cavity. So that is about pelvic surface. Here one margin is there. Actually, this is medial margin of ischial tuberosity. It is more prominent. This margin will give attachment to the sacrotuberous ligament, right? So this is about body of ischium. Then we will discuss about ramus of ischium. See, this is ramus of ischium, right? This ramus of ischium extending from body of the ischium and extending upwards and forwards. See, it is extending upwards and forwards and united with ramus of the pubis and forms Ischiopubic ramus or conjoined Ischiopubic ramus or conjoined ramus. So this is conjoined ramus, right? So this conjoined ramus having upper border and lower border. Upper border is forming the boundary of obturator foramen. It is giving attachment to the obturator membrane. But this lower margin, see, this is lower margin. This lower margin is everted, but it is more prominently everted in case of males because there will be very strong attachment by the crus penis. But in case of females, there will be attachment of crus clitorius. It is weak attachment. That's what it is less everted. This is inferior border. Then here two surfaces are there. If there is two borders, there will be two surfaces. So this is upper border, lower border. So what is this surface? This is outer surface and this is inner surface. First, if we take outer surface gives attachment to some muscles from medial to lateral side. First one here, actually up to here, this is ramus of ischium. this is ramus of pubis. Both are united and forms conjoined ramus. To make it simple, I am telling the attachment of ischiopubic ramus concludedly. Instead of telling pubic ramus attachment separately, ischial ramus attachment separately. So along the medial margin of ischiopubic ramus, there will be attachment of gracilis. Here there will be attachment of gracilis muscle. Next to the gracilis, there will be adductor. For color differentiation, I will draw with a different color. Here adductor brevis. Adductor brevis. Then we know that this is adductor magnus, the lateral part of lower part of ischial tuberosity. This is adductor magnus, right? This adductor magnus is coming like this. So adductor magnus. Then anyway obturator externus, right? So these are the muscles you have to remember from medial side to lateral side: gracilis, adductor brevis, adductor magnus and obturator externus. Then conjoined ramus having the inner surface. So this is inner surface, right? This inner surface is convex and it is divided into 3 parts by 2 ridges. See, 2 ridges are there. These 2 ridges dividing the inner surface into upper part, middle part and lower part. This upper ridge gives attachment to the superior fascia of urogenital diaphragm. Then this inferior ridge giving attachment to the perineal membrane or inferior fascia of urogenital diaphragm. Now we should know what are the different attachments for these 3 areas, right? This upper area is very easy because it is present along the margins of obturator foramen. So what muscle is attaching here? Obturator internus. So this upper part attached by obturator internus, right? Then in between the upper ridge and lower ridge, there will be 2 muscles. Okay, one muscle is deep transverse perineae and another one is sphincter urethra. Here sphincter urethra and deep transverse perineae, right? So these are the 2 muscles are attaching here. Then inferior part. This inferior part gives attachment to the crus penis in case of males, crus clitorius in case of females, right? Crus penis and crus clitorius covered by one muscle. What is that muscle? Ischiocavernosus. So ischiocavernosus. Then one more muscle will be present, that is present transversely, that muscle what we are calling superficial transverse perineae, right? So these are the structures which are attaching to the inner surface of ramus of ischium and pubis. We have completed ischium. Then we will discuss about pubis. See, this is pubis. Pubis having body, inferior ramus and superior ramus, right? So this is superior ramus, this is inferior ramus, right? We have completed inferior ramus, right? So no need of much description about the inferior ramus. Now we have to study about body and superior ramus only, right? So if you take the body having anterior surface, see, this is anterior surface and this is posterior surface, and here one more surface is there, that is medial surface, right? This medial surface we can also call as symphyseal surface, right? So this is symphyseal surface because it will articulate with the opposite symphyseal surface of the opposite hip bone and forms the symphysis pubis. So this is symphyseal surface. Then posterior surface. Posterior surface is smooth and it is in relation with the urinary bladder. That means urinary bladder will be present here. Urinary bladder and the posterior surface of the body of the pubis separated by one space. That space what we are calling retropubic space of Ridgius, right? That retropubic space of Ridgius contains fibrofatty tissue, right? That we will discuss later. At this session, you remember that this is posterior surface of the body of the pubis. It is in relation with the urinary bladder separated by retropubic space of Ridgius, right? And it gives attachment to the levator ani muscle also. Anterior surface of the body. See, this is anterior surface of the body. This is superior border of the body of pubis. Superior border of body of the pubis will be thickened and forms one ridge. Actually that ridge is broken here, right? So if you want to see that, see, the superior border of the body of pubis is thickened and forms the pubic crest. This is pubic crest and this is symphyseal surface. In between the pubic crest and the symphysis surface. Here one angle is formed. Here there will be attachment of one muscle. That muscle what we are calling adductor longus. So here adductor longus muscle will be attached. Just below the adductor longus there will be attachment of adductor brevis, and here gracilis, and here obturator internus. So these are the attachments of anterior surface of the body of pubis. See, this is pubic crest. The upper border of the body of the pubis thickened and forms the pubic crest. This is pubic crest. The lateral part of the pubic crest forms one tubercle. This tubercle what we are calling pubic tubercle. So this is pubic crest and this is pubic tubercle. What are the structures which are attaching to the pubic crest from anterior to posterior side? Fascia lata. Fascia lata is nothing but deep fascia of thigh. Then anterior layer of rectus sheath. Then rectus abdominis muscle. Which head? Lateral head of rectus abdominis. If pyramidalis muscle is present, pyramidalis muscle. Then conjoint tendon. After that fascia transversalis. Right? So these are the structures attached from anterior to posterior side. Recollect once again. Fascia lata, anterior layer of rectus sheath, rectus abdominis muscle. If pyramidalis is present, pyramidalis, and conjoint tendon, transverse abdominis fascia or fascia transversalis. Then pubic tubercle. Pubic tubercle gives attachment to the medial end of inguinal ligament, lateral crus of superficial inguinal ring, superior crus of saphenous opening, apex of lacunar ligament, reflected part of inguinal ligament, and ascending limb of U-shaped loop of cremasteric muscle. Right? So these are the structures which are attaching to the pubic tubercle. Don't worry about all these terminology. Whenever we encounter those terms, we will keep explaining you. So at this session, just remember the words only. Right? So that is about body of the pubis. Now we are discussing about the ramus. Which ramus? Superior ramus. Right? See, this is superior ramus which is extending from the lateral part of the body and it is projecting backwards and upwards and reaching to the ilium and forms one eminence here. This eminence what we are calling iliopubic eminence. Right? So this is iliopubic eminence. It is having posterior border, anterior border and inferior border. Okay, let me show you here. This is posterior border, this is anterior border, and here is the inferior border. Right? So this posterior border we can also call as pectinate line or pectine pubis. Right? Then this is anterior border, no? This anterior border we can also call as obturator crest. This is obturator crest, and this is the inferior border. This inferior border will give attachment to the obturator membrane. Right? And it is leaving the gap. See here, here one groove is there. This is obturator groove. Along the margins of obturator foramen, there will be attachment of obturator membrane. Except here, it is leaving the gap here. For what? For the passage of obturator vessels and nerves. So except here, total obturator foramen attached by obturator membrane. This canal what we are calling obturator canal. Through this canal, obturator vessels and nerves are passing. That is about inferior border. Then this is posterior border. This posterior border we can also call as pectine pubis or pectinate line. It is extending from the pubic tubercle to the iliopubic eminence as sharp line. This sharp line what we are calling pectinate line. This pectine pubis having some attachment. What are those attachments? For our convenience, we will divide this line into medial part and lateral part and we will see the attachments. First, if we take the medial part will give attachment to the lacunar ligament, reflected part of inguinal ligament, conjoint tendon, fascia transversalis. What are the structures attached to it? Lacunar ligament, reflected part of inguinal ligament, conjoint tendon and fascia transversalis. That is for the medial part. Then lateral part, all structures are starts with P. What are those? Pectineal ligament or ligament of Cooper, pectineus muscle and fascia covering the pectineus muscle. That means pectineal fascia. After that, psoas minor if it is present. Usually it will not be present. If it is present, psoas minor will be attached to the lateral part of pectineal line. So that is about pectineal line. Clear? Then what is this? This is obturator crest, right? This obturator crest extending from the pubic tubercle to the, what is this? Acetabular notch, right? So that is about obturator crest. Then what is this? This is the surface. It is present in between the anterior border and posterior border. What is this surface? This surface what we are calling pectineal surface. This is pectineal surface. This pectineal surface is present in between the anterior border and posterior border of the ramus of the pubis. That means it is present in between the obturator crest and pectinate line. This pectineal surface gives origin to the pectineus muscle. Now we will see about acetabulum. See, this is acetabulum, right? This acetabulum having the C-shaped margin, but in the lower part there is no margin, is it? So it is forming like a notch. This notch what we are calling acetabular notch. This acetabular notch is bridged by one ligament. That ligament what we are calling transverse acetabular ligament, right? Because of this transverse acetabular ligament, that means below this ligament we can see one foramen, right? So this foramen what we are calling acetabular foramen. Through this foramen, acetabular branches of obturator vessels and medial circumflex vessels will be passing, right? Then this is acetabulum, no? The acetabulum having C-shaped articular surface. See here, this is C-shaped articular surface. This C-shaped articular surface what we are calling lunate surface, right? Within the center there is no articular surface, right? So it is like a fossa. This fossa what we are calling acetabular fossa. This acetabular fossa filled with fat. Then the margins of lunate articular surface gives attachment to the acetabular labrum. This acetabulum is formed by ilium, ischium and pubis. Upper 2/5 is formed by ilium, lower and posterior 2/5 is formed by ischium, anterior and inferior 1/5 is formed by pubis. So this is about acetabulum. Now we will see ossification. See, these are 3 bones, right? 3 bones having the 3 primary centers. One primary center for the ilium, one primary center for the ischium and one primary center for the pubis. Primary center for the ilium will be formed at the 2nd month of intrauterine life, for the ischium month of intrauterine life, for pubis around 4th month of intrauterine life. These primary centers united at the age of 18 years. Then secondary centers, 2 for the iliac crest, 2 for the iliac crest and 2 for the Y-shaped triradiate cartilage and 1 for the ischial tuberosity. All these secondary centers will be formed at the age of puberty. Then around 20 to 25 years of age, these secondary centers will be fused. But this triradiate cartilage will be fused at the age of 17 years itself. That is about ossification centers. Then if you want to see the 6 differences, see, this is obturator foramen. In case of females it is triangular and small, but in case of males it is oval and large. This is Ischiopubic ramus. The inferior margin of Ischiopubic ramus is thin in case of females, thick in case of males. It is more everted in case of males, but in case of females it is less everted. Acetabular diameter. This is acetabular diameter. Take the transverse diameter of acetabulum and take that diameter here, right? In case of males, both will be similar. See, this is male, this is transverse diameter and this transverse diameter. Both are similar. But in case of female, see, this is female hip bone. See, this is transverse acetabular diameter and this is pubic diameter. See, pubic diameter is more than the transverse acetabular diameter. That means this belongs to female. Then any other differences? Preauricular notch. See, this is preauricular notch. This preauricular notch is more prominent in case of females. Okay, why I told you? This is preauricular notch. This preauricular notch is more prominent in case of females than males. And what is this? Iliac fossa. This iliac fossa is shallow in case of females, but in case of males it is very deep, right? This is greater sciatic notch. This greater sciatic notch is more wider in case of females and narrower in case of males. These are the 6 difference. Clear? So that is about hip bone. That's it for this session.